Hi, this is Dr. Tom Rogers at Performance Medicine, coming to you with the weekly Common Sense MD. That's what we need is more common sense these days. Um, it's a new year, and in continuing with last week's podcast, I want to keep on this because I think it's important in the way that you're going to be successful with anything. And so I'm going to talk about habits because I've always said that, to be successful people have habits. They have routines that make them successful. So as the new year approaches, it's here. You need to think about your habits, which I equate with behaviors. A lot of what I see as a family doc are problems with anxiety, depression, and which leads to real disease. And those are real diseases in themselves. So you can't be a family doc for all these years and not recognize the fact that people that come into your office are searching for answers to become more successful with their health. And a lot of times that's as mental as it is physical. So I'm going to talk about habits or behaviors. I just finished reading a great book called Atomic Habits by James Clear. It's a New York bestseller. You need to think about reading that book. And part of what I do in these podcasts, and as a physician as well, is to try to dig. I'm a researcher. I may not be in a laboratory working with mice and doing double-blind studies, but I'm a researcher because I'm continually reading, I'm observing, and I'm treating patients, and hopefully I'm good at it. So what I'm trying to do as a doctor is teach people how to become successful with their health. So you talk about behaviors. We see this all the time. So when I talk about habits, I'm talking about behaviors. So let's talk about it a little bit. Over 50%, over half of our behaviors are habits. So I'm going to kind of equate them. So think about the behaviors. Bad habits or behaviors give you immediate impact. Think about that. Bad habits like maybe smoking a cigarette give you an immediate impact. I guess they make you feel good. I'm not a smoker, but people smoke for a reason. It's a bad habit without a doubt in anybody's mind. But they give you an immediate impact, a feeling that's immediate. Really, with good habits or behaviors, it's a delayed impact. You're not going to go to the gym and one time or two times or even a week or a month, and it's not going to have an immediate impact on you like that. It's going to take a while. It's a process. But remember, progress is a good feeling. So we're kind of wired a little bit for immediate impact, but the way our society has gone, it's really more focused on delayed gratification. I mean, why would anybody else go to school this long, to be able to practice medicine or do any job? Why would you spend that much time building a career? Because it doesn't feel great when you're doing it. It costs money. It's a lot of effort, but you're looking towards delayed gratification. And you need to learn to enjoy the journey as well, because that's where really the dopamine, which I'll get into in a minute, hits. It's on the journey, not at the goal. So progress does feel good. Results will come if your systems work. A system is a way of doing things. So you need to think about the systems that you use for success. Like I said, a goal is a one-time thing. So when you reach a goal, it does feel good, but systems are long-lasting. They're lifelong habits, which are your systems. And that's where the ultimate reward is, in these systems that get you on the path to where you're going. Because when you get there, otherwise, it's not going to be worth it. Enjoy the systems and the journey that you're pursuing. With habits, make them small at first, small habits, and layer them on each other. Um, and collectively, they will give you powerful results. So think about that. Another thing you need to think about, which I talk about a lot, is identity change. Um, I talked about identity a lot in last week's podcast. But habits really are a signal to who you are. Um, for example, me. I take me and the guitar as an example for a lot of things because really, I would love to be a great musician, and whether I am or not, I have to start thinking about it differently. If you understand what I'm saying, I'm going to explain it. So you really need to see yourself, like I need to see myself as a guitar player because I practice the guitar a lot. And if I don't see myself as a guitar player, I won't be a guitar player. The same thing with healthy habits. Same thing with weight loss, really. If you think of yourself as a healthy person, then you're going to act like a healthy person. And if you act like a healthy person, you're not going to drink Cokes all the time and eat junk food all the time. If you have that mindset that you're a healthy person, you won't act in an unhealthy way. You really have to believe this. So I have to believe that I'm a guitar player in order for me to be able to play songs and to use the habits, the practice that I do to play music. So I have to believe I'm a guitar player, and I do. But it's been just very recently. So the best way to change your identity is to start with the small things over and over again. And you really need to work more on your weaknesses and your strength. I found that to be true in sports as well as anything you do, whether it's music, guitar playing, whatever. In other words, success rarely comes with an epiphany. Sometimes it does, but they're rare. Usually it's more of a repetitive thing, repetitive behavior that becomes ingrained in you. It's a process. So rarely is it an epiphany. Now, sometimes certain things like reading a good book or getting a good idea in your head can lead to change, but it's usually not overnight. Although sometimes it is, but usually that comes with a major environmental change, something major. So for the most of the behaviors or habits, we're talking about slow progress, but it can be fun. So you've changed when that becomes ingrained in you, and it will bother you if you don't do it. It's part of you now. So it bothers me if I don't get a little bit of guitar in every day. It may bother you if you don't work out every day. If you miss a day of workout, it bothers you, and that's when it becomes ingrained in you. And this may take a while. Like I said, it's a journey, but you can hack a rapid way of behavior change. Like if you're in a bad group or in a place that's miserable for you, life-changing things could mean moving somewhere. Make it a situation in those cases when it gets so bad that you can't go back. Like quitting smoking when you have a child and you decide that I can't expose this child all their childhood to secondhand smoke. So some people can change overnight in those kind of situations, and that can be a good thing. You also need to take pride in your identity, your new identity, if that's what you're seeking. And a lot of us should. Like, your new identity is being a lean, fit person in contrast to thinking yourself as fat and out of shape, no hope for you. You can have a new identity, but you need to take pride in it. You should. Also think about the social aspect of this thing. We're social creatures. I talked about it last week. Behaviors that stick have this social component to them. Like You mow your yard because you don't want your neighbors to think you're a slob and you have overgrown yard or trash out in your yard all the time, because that's a social aspect of this thing. So join groups where you have the desired behaviors being normal, not abnormal behavior. Like socialize with people that you want to be like, that they're fit, they're going to the gym, you're going to the gym with them. If you like music, you're going to listen to music. You're practicing guitar with them. Bad habits can be the same thing. If you go to the bar every night and drink every night, you're around those people that I guess you want to be like them. So look at what you're doing, who you're associating with, and those social aspects of who you want to be. I talked about last week getting away from negative people. I think that really is very important, because you're going to end up more like the people you hang around with. People want to fit in. They really do. The desire to belong overpowers the desire to be lonely. So remember that. You need motivation to change, and you need reward to change. That's where this neurotransmitter dopamine comes in that we study so much. Some people hack the release of dopamine using drugs or food. Think addictions. That's how that happens. So when I read this guy's book on atomic habits, I learned a lot. And all habits have 4 things in common. Think about this. They all have a cue, like that cigarette laying there before you if you're a smoker. That's a cue. Then comes a craving for that. Then comes a response. Are you going to smoke it or take a drink? Or are you going to leave it alone? Then there comes a reward, either for doing it or not doing it. So think about these. All habits have those things in common. They have a cue, a craving, a response, and a reward. So keeping that in mind, there's 4 laws of behavior change that Mr. Clear talks about in this book. So habits are behaviors. So 4 laws of behavior change. One is make it obvious what you want to change. So have it around. Make it obvious what you want to do. For me, it's putting guitars around different rooms. When I'm in a room, I'll go pick it up and play it so it's there. Make it attractive. I want a nice guitar. I may want a nice amplifier, a new set of strings. It sounds good. So make it attractive what you're trying to change and become a part of your life. Make it easy. It's convenient. If the healthy food's laying around, it's convenient for you to eat it. Make it satisfying. Play some good music and try to emulate that. Keep some pictures up of lean, fit people that you want to be like. So make it obvious, make it attractive, make it easy. If it's too hard, you won't do it. And make it satisfying. And again, you're looking at the long run. Now, to break bad habits, you need to do the opposite. What do I mean by that? First of all, don't make it obvious. Make it invisible. Don't have the junk food around your house. Just if it's not there, you're not going to eat it. Instead of making it attractive, make it not attractive. You can look at it that way as well. Make it not attractive. I mean, people that are drunk or that smoke, they don't look good. It's not attractive. Don't make it easy. Make it hard if you're trying to break these habits. If you don't have that junk food laying around, you'd have to go to the store and get it. So make it hard to do. And also make it unsatisfying. If it's not satisfying, if it's unsatisfying, you can break a bad habit. That's why some people will use medicines to get them off a drug, because when they use it on the particular medicine that they're trying to break their habit, why it makes them sick. So we do that a lot in medicine. So make it unsatisfying if you're trying to break a bad habit. Do the opposite. So focus on your good habits, because if you spend a lot of time focusing on good habits, you're not going to have time for the bad habits, and they'll gradually phase out. And you need to remember, everybody backslides a little bit. So learning to forgive yourself for, eating too much that day or drinking too much, you need to forgive yourself and get past it, because we all need to pick ourselves up and kind of laugh about it and get back on the right track. I mean, we're humans and we're going to fail at times. But, like I talked about last week, you need to laugh at the failures and go on. It's part of life. But so forgive yourself for backsliding a little bit and get back on track, and use these tools to help you develop good habits. So if we are creatures of habit, you want to make them good habits. So as you get into this year, 2023, think about behavior changes. We all know bad behavior when we see it in other people, maybe not so much in ourselves. So listen to people, especially your loved ones, maybe your doctor, and let other people help guide you towards health. Think about this on behaviors or habits. There's a good way to get into better habits and to live a much healthier, happy life. I hope you do have a good 2023. We'll get into more specifics on how to do everything in every weekly podcast, but I want these themes to be a part of your 2023 and start having them in the forefront of your mind as you go on and your journey towards a healthful, happy, productive life. Thank you. I'll see you next week.